Excellencies, ladies and gentlemen, in Kenya, hepatitis B affects 3.0% of the general population and 4.7% of people living with HIV, with higher prevalence in some regions like Turkana, Baringo, Migori. Hepatitis C is concentrated among people who inject drugs with an antibody prevalence of 19%, varying widely across regions. People living with HIV are central to the response, and we have prioritized this population within country responses in all settings, acknowledging that prevention of mother-to-child transmission of hepatitis B infection is a cornerstone of efforts to support progress towards elimination of viral hepatitis. As a country, we have also made elimination of vertical transmission of HIV, syphilis, and hepatitis B, and has prioritized this elimination of mother-to-child transmission of HIV, syphilis, and hepatitis B. Ladies and gentlemen, we have had key interventions and expected outcomes in Kenya, and one of it being the policy framework update, which the ministry through our agency is in the process of reviewing and updating the national guidelines for the control and management of viral hepatitis to align with the global targets. Secondly, we have set up our technical working groups, a group of experts that is discussing on policy on viral hepatitis in Kenya. Laboratory strengthening is on course for the diagnosis and surveillance of hepatitis to reduce the number of undiagnosed cases across the key population. Triple Elimination Initiative, which Kenya is focusing on elimination of mother-to-child transmission of HIV, syphilis, and hepatitis B through universal infant immunization, routine screening, and antiviral for hepatitis B positive pregnant women. Linkage to treatment and care, and this means addressing the gap in diagnosis and ensuring those with HBV and HCV are linked to treatment. And currently, only 10% of people with hepatitis B and 20% with hepatitis C are diagnosed, largely due to low public awareness. We have strengthened procurement and supply chain systems, ensuring the continuous availability of hepatitis-related healthcare commodities to prevent disruptions in services. We are equally dealing with vaccination and harm reduction, expanding vaccination coverage and promoting harm reduction services, especially for high-risk groups such as people who inject in drugs. Again, enhanced surveillance system which is established to accurately track hepatitis cases and guide policy decisions. And of course, sustainable financing, that is the advocacy for long-term sustainable financing, is key to supporting hepatitis control efforts, including research and partnerships to promote policy and healthcare sustainability. Research is very key, with our premier research institutions gathering evidence that is data-based that will inform policy, improve care delivery, and adapt strategies for hepatitis. Capacity building for health workers. We have already done an assessment of all the levels of health facilities in our country, and we have seen the gaps where we have in terms of health, human resources for health, in terms of equipment, and equally in terms of infrastructure. And this, we are developing a training package for healthcare workers to optimize prevention, screening, and leakage to care. And in this, we have been able to train, equip, and give a stipend to 100,000 community health promoters. In fact, as at now, it's 107,000 community health promoters, and their role is to move from household to household, to ensure that they take blood pressure, blood sugar, remind caregivers and mothers on when to take their children for vaccination, ensure that they keep tab with patients of this level, HIV, hepatitis, and drop for them medicine should they require. Therefore, it is important to improve the quality of care in terms of human resources for health. In conclusion, addressing hepatitis is very, very critical, and especially to improving the public health outcomes in Kenya. We are already moving from more curative to preventive and promotive. And with the recent developments in diagnosis, treatment, and vaccines, it is now within our grasp to meet the WHO's challenge of eliminating hepatitis as a major public health threat by the end of the decade. And happy to unite with Group of Friends Forum to share innovations and lessons learned to eliminate hepatitis. Have a great morning.